my presentation, I would like to thank the organizing committee for giving me this opportunity. So good morning, everyone, and I'm going to talk about the role of AI technology in pathology of head and neck cancer. So what marks the fourth industrial age? It is the integration of artificial intelligence, machine learning, deep learning, robotic, and big data with our physical daily lives. And AI can be visualized under two main fields. It can be artificial general intelligence. It can be artificial narrow intelligence. And when we talk about medicine, it is more about artificial narrow intelligence. The foundational cores of AI are knowledge representation and reasoning, Bayesian interference, and self-awareness. So what exactly does artificial intelligence do? So it has components like machine learning and deep learning. Now, in machine learning, there is a utilization of algorithm that detects pattern within the existing data and then trains itself to make the prediction on the new data. So it's a very simple concept. The machine will learn to identify the images, and when you give data to the machine, it will then confirm that what exactly it is. And this is done through reinforcement and dimensionality reduction. Now, this is a very simple thing. It's just identifying the pattern, but there is a deeper concept to it, which is deep learning, and this more closely mimics the human brain. Now, this is more complex functionality. It can provide decision-making capabilities and can handle extremely large data sets. So this has revolutionized the performance in several visual computing fundamental problems and segmentation. So it helps in image identification and discrimination. There are various algorithms. I'm not going to go into details of it, but these are the names. Artificial neural network. It is simplest of all. It has just 3 layers, an input layer, output layer, and a hidden layer. And this is most commonly used with machine learning, simple patterns. And most commonly used with deep learning is a convolutional neural network. It has multiple layers closely mimicking the human brain. Apart from that, there are recurrent neural networks, transfer learning, and generative adversarial networks. Now coming on to the talk, which is about artificial intelligence and medicine. So where do we see it? Now in medicine, the most prominent application of deep learning has been its use in detection of abnormalities or disease in radiology and pathology. So deep learning-based pattern recognition applications have been effective in analyzing large medical images and can accomplish many tasks, including object detection. So it helps in identifying the location of the lesion of interest and image classification. So it helps in generating the differential diagnosis. Now, being specific for pathology, AI-based tools in pathology have the potential to automate workflow processes, improve diagnosis, standardize reporting, and quantify scoring. It provides information that most pathologists today are unable to provide using light microscopy, such as reporting about prognosis and predicting therapy responses. So the intent of the computer vision is to significantly reduce misdiagnosis and human error secondary to work-related fatigue and burnout. And also the integrating machine learning with automated microscopic image analysis reduces the intra and inter-observer variability and therefore improves the objectivity and reproducibility. Machine learning is found beneficial in 3 aspects essential for diagnosis and prognosis. It improves accuracy of cancer susceptibility, recurrence, and survival prediction. So the application of machine learning in healthcare are aimed at assisting clinicians in making informed decisions, reducing diagnostic errors, improving and promoting overall patient health. Now, the major breakthrough when it comes to the pathology is the concept of big data and whole slide images. So previously, the concept of small tissue array was there. So if you have a small tissue array, so there's a small portion of the complete tumor that is being analyzed. So the morphological variation that are present in the tumor are not captured. But when we go for a whole slide image, it has more advanced and detailed capturing of the information. So by AI-based tool to analyze the histopathology whole slide image, we are now able to enhance and possibly automate pathology diagnosis, quantify parameters of the tumor microenvironment better. Now, coming on to the published literature. So let's see what the literature has to tell us. Now, this is the article that was published in 2020, Mahmood. It's a use of artificial intelligence in diagnosis of head and neck, precancerous and cancerous lesion. It's a systematic review, and they screened through 315 records and included 11 for the analysis. So there was 1 article on oral epithelial dysplasia, 1 on oral submucous fibrosis, 4 on oral squamous cell carcinoma, and 1 on oropharyngeal squamous cell carcinoma. In this, a combination of heuristic, supervised, and unsupervised learning method were employed. So these are the methods of machine learning where you annotate the images or you just let it be and machine analyze on its own. More than 10 different classification and segmentation techniques were used. And this was not a whole scan image. It was just a sub-image. And so most studies used unicentric data comprising of small sub-images ranging from 40 to 270 images. And the accuracy with this approach ranged between 79 to 100%. So this is something that provides early evidence to support the potential application of supervised machine learning methods as a diagnostic aid. So this is just a table which summarizes the approaches that they have taken. So they have looked at the nuclear phenotypic score. They have looked at the keratin pearls. They have looked at the collagen fibers orientation in the subepithelial tissue, immunohistochemistry. They have looked even at the anti-CD34 antibody. And then they have tried to identify these lesions. And with pretty decent accuracy, as we can see, upwards of 90%. Now, this is another article which was published by Bassani et al., recently published November 2022. And this looks at the head and neck diagnosis, cancer diagnosis using the artificial intelligence. And again, there were 13 articles, 6 for the oral cavity, 2 for larynx, 1 for salivary gland, and 4 for head and neck cancers. 12 looked at histopathology and 1 at cytology. So here we see just a summary of oral cavity. It's a very busy slide, but I'll just come to the crux of it. Here we see 6 articles of the oral cavity. And again, they have looked at the keratin pearls. They have looked at the texture, color, and shape to identify the cancers. The accuracy has been pretty decent, upwards of 90%, with sensitivity upwards of 90% and area under the curve of 0.92. That's a good diagnostic accuracy. But what I would also request you to is look in this the column which I have not highlighted. These are very small numbers, 10 patients, 25 low-grade squamous cell carcinoma. So small numbers are there. Now this is looking at the larynx. Again, now this is a little decent number, 45 image patches, but from 20 slides. And again, when it comes to larynx, there is a good accuracy, which is around upwards of 90% and AUC of 98.981 when it's the testing data set, and for validation it is 0.99. So it's very, very important that it's being done at both the levels, at the training set and validation set, so that we know that the model is working properly across all the cohorts. Looking at the salivary gland, again, a good accuracy achieved of 84.6%. And these are the not specified sites of head and neck cancer. Again, a decent accuracy, slightly lesser than what we just saw before, but in the ranges of 70 with a sensitivity and specificity, again, ranging from 70 to 100%. So this was the common subsites. Now, when we come to the rarer tumors, relatively rare tumors, again, we see that there's a role in nasopharyngeal carcinoma. So this is, again, a systematic review published in 2022, 60 papers. And they looked at, again, both machine learning and the deep learning. And they found that CNN accounted for majority of DN learning algorithms, whereas ANN for machine learning model. And overall positive impact identified from AI implementation in the management of NPC. So this was the author's conclusion. But important point here to note is that it is taking it a step ahead, and now they're looking at the microRNA in addition to normal histopathologic slides. And it helps in identifying the biomarkers for predicting the prognosis, making the diagnosis, making the nomograms, and even helping the clinicians to take the decisions. This is the WSI images, again, good for the clinical diagnosis, predicting the survival, and developing a nomogram. Now, being more site-specific, major work has been done mainly in the oral cavity cancer, and this is AI in various aspects of oral cavity cancer, right from screening, diagnosis, predicting survival, looking at the grade. So this is to evaluate the AI in detection, diagnosis, classification, and prediction of the histopathological images for oral cancers. And again, the original articles were included in this analysis, 19 articles. And what did the author find was that AI model in these studies displayed the accuracy in the range from 89.47 to 100%, sensitivity upwards of 90%, and specificity upwards of 90%. So these models have the ability to diagnose, classify, and predict the occurrence of oral cancer, outperforming existing clinical approaches. Just to highlight the key points from the studies. So 7 oral cavity studies that were included for the diagnosis. Now here, keratin pearls were used to identify, which worked well based on the keratinization index. They were able to identify the oral cancers. based on the immunohistochemistry. As I pointed out before also, they were able to identify these cancers. And when they looked at the comparison with the pathologist, so they identified that deep learning algorithm outperformed pathologists in accurately identifying oral squamous cell carcinoma. So if a junior pathologist were to identify it alone and in conjunction with the AI, there was faster diagnosis with lesser 6.26 minutes. So computer-aided tool for detecting and delineating nuclei from oral histopathology slides can also be exploited to diagnose oral squamous cell carcinoma. Now, effectiveness of AI in predicting survival in oral cavity patients, taking it a step further. So classifier based on image analysis that uses quantitative histomorphometric features to assess nuclear shape, size, and texture diversity in the cells to identify and prognosticate these patients. So this was a model which seemed to be promising. And when it comes to grading, which is based on fuzzy cognitive maps, again, it was a good accuracy to identify the low-grade tumor where they could identify correctly in 90% of the cases, and again, 90% for the high-grade tumor. Now, this is another article which looked at even a more number of studies. Now, this is just 41 studies, similar to the previous one. Something very similar, the conclusions. So majority of the studies use the support vector machine and artificial neural network algorithm as machine learning techniques. And specificity ranged from 0.57 to 1, sensitivity again from 0.7 to 1, and accuracy 63.4 to 100%. Authors also looked at the limitation with the AI. So the main limitations and concerns with AI can be grouped as either the challenges inherent to the science of machine learning or relating to the clinical implementations. Now, we saw so many systematic reviews and meta-analysis. So do we really have a robust, strong evidence to suggest AI in pathology? So this is a critical analysis of all the systematic reviews. And what do these authors have to tell us? That when they look at all these published articles from the inception to November 30, 2022, so they searched 137 articles, 17 fulfilled the inclusion criteria. And these articles looked at the detection of precancerous and cancerous lesion, prediction of histopathological nature of the given lesion, prognostication, extraction of the pathological imaging, and different application in the radiation oncology. They found some limitations that were the lack of standardized methodological guidelines for the collection of clinical images, lack of development of these models, lack of reporting of their performance, lack of external validation, and lack of regulatory framework. So there were some limitations related to all this. So these were all in the routine diagnosis and prognosis from the histopathological slide. Now, can we take it a step ahead? Now, this article looked at the tumor microenvironment, that is a tumor infiltrating lymphocytes, and their abundance then was segmented and identified as a score, and this score was then used. So deep learning based tissue segmentation achieved the high accuracy of 96.31, and it was a strong prognostic indicator of disease-free survival. And when they looked at the TIL abundance score that was based on the machine compared to the manual TIL score, the machine learning based TIL score had a higher prognostic value. So there is promise, and we are taking it a step ahead in the tumor microenvironment. Now, there comes a question, it's too much of pathology and we all are surgeons and clinicians. So do we really see somewhere apart from diagnosis and prognosis? Yes, I do see it somewhere else. And this is like, we know now that sentinel node biopsy is coming up in head and neck cancer, especially in early oral cancer in a big way. And one of the major challenges when it comes to the sentinel node biopsy is the labor intensive pathology protocol. So can we really help them there? And so far, we have no data to support from head and neck, but this is just to tell, yes, there is something which is being done in breast and we can extend to head and neck tumors. So this is the attempt to identify isolated tumor cells, micro and macro metastasis. We do see limitations with the ITCs, as we can see in this, that only 40% of the cases can be currently identified. But when it comes to micro and macro metastasis, we have a good identification rate and good accuracy. So we can work upon this aspect, and this will help us in head and neck tumors. There are finer nuances. We can again extend in head and neck tumors as well, and these are looking at the nuclear features. So these are from other subsites like prostate, breast, kidney, and lung, but we can think of looking at it in head and neck cancers. And we can use all these as a prognostication. So with all this background now at Tata Memorial Hospital, we are coming up with a new protocol, and we are going to look at the tumor immune microenvironment based risk stratification of early oral cancer using deep learning. And we are going to use this for limiting the surgical neck dissection. And in our study, we are going to train and validate the the deep learning-based model on baseline diagnostic biopsy to predict the lymph node metastasis at surgical resection. We're going to train, validate, and test a short-term outcome prediction models for clinically early-stage oral squamous cell carcinoma. And our secondary objective is also to identify the nodal metastasis and categorize them into macro, micro metastasis and isolated tumor cells. Now, having said it all, there are certain limitations, and I would like to highlight the limitations of machine learning. So one is because of the machine learning inherent to the machine learning, which is a black box concern, where we are unable to understand how the machine has processed the data and what output is it giving and how is it giving that output. The amount and quality of the data used in training. So there has to be good quality data and high volume of data that should be used. Unintended fitting of confounders as input variables. So wrong information will be interpreted as information, and then when it comes to applying these model ahead, is going to create problems. And generalizability of the model. So if it's an overfit and we have just modeled it on some little cohort, it's going to be very fit for that particular cohort, but it's not going to work on other cohorts, and that is overfitting. And usually these models are based on the retrospective data. So if we don't have the adequate representation of some particular subsection, these data will be missing. And then when it comes to the prospective data, we cannot apply it. There can be clinical concerns as well. So the clinician cannot explain the machine learning models. It can affect the patient-clinician relationship. And also it can intimidate the clinician thinking it's a superhuman analogy and a job competitor. And then, of course, we have the ethical concerns because there is a lot of patient data that is being used. So we have to ensure that the privacy of the patient information is being maintained and it's being done according to the ethical considerations. The backbone of any kind of a machine learning when it comes to pathology is data. So we have to ensure that we have a good quantity and quality of data. Prospective data is preferable, and big data that is heterogeneous and from multiple sources will give the nuances that are needed for the modeling. External validation should always be done. When we develop a model on the training set, please validate it on the external data. So we should have a high volume data, high velocity data, high variety, high variability data. So take-home message is that machine learning models have significant potential for delivering highly accurate detection of cancer with better sensitivity, specificity, and precision. This can significantly aid pathologists in improving their diagnostic outcomes and reducing the probability of errors. AI presents remarkable prospects for automation of tasks by identifying intricate patterns, but all this comes at its own cost and its own limitation. Thank you.
Thanks, Dr. Richa, for a nice insight. And more importantly, what the premier institute of the country is planning to go ahead with this machine learning model for our early oral cancers. Now, any questions from the audience, please?
Cervical cancer screening using a handheld AI-enabled smartphone. I understand that there's a large trial which is going on a device developed at Manipal. Even Tata Memorial Hospital is part of it. Any idea on what is the current status of this project?
Sir, I'm sorry, I'm not aware about the current status of it, but the limitation when it comes to the detection of occult metastasis in these cancers is that when we're talking about the isolated tumor cells and micrometastasis, any kind of imaging or handheld probe may not be very helpful in identifying these. So sentinel node biopsy, which is used intraoperatively, that's a handheld gamma probe. So it's very, very sensitive and it's detecting the sentinel node, and then we are doing the serial step sectioning to identify these. Otherwise, to this day, I'm not aware of any other method that can identify these cells except for the SNPs.
Okay, thank you.